And we welcome you back to our program for today. You know, a topic that's been much in the current discussion on the healthcare reforms being proposed in our country is end of life, and how we as patients and how the medical community deals with end of life issues. Joining us today, someone who's an expert in that field. Joining us today is Trudy Jenks, who's an RN, and she's the clinical coordinator for Hospice of Saddleback Valley. It's a department of the Saddleback Memorial Medical Center. Trudy, welcome to the program.
Thank you.
Let's define that, hospice. What exactly is hospice care?
Hospice is a program designed for people who have a life expectancy of 6 months or less. That's not to say that people can't be on hospice longer, but that's the intent of the program. It has to be ordered by your doctor, and the doctor has to agree that your life expectancy is 6 months.
Okay, and that's usually the primary care physician makes that decision?
Often, or perhaps the hospitalist that's seeing the patient in the hospital for a bout of illness.
All right. Now, a lot of discussion on these end-of-life issues right now. I know there's a situation in some countries where people can actually, in fact in one of our states in this country, where people can actually hasten that process. That's not what hospice is all about.
No. Hospice is about living. It's about living until the moment that you die, and that's what we're about. We're about planning for that. We're about making that happen the way patients and families and loved ones want it to happen. So if we're able, that's what we do.
Okay. My understanding is it's not just one person, but it's a team approach with lots of people involved, headed by you, but there's a lot of other folks involved in the process.
Oh, absolutely. Along with the other managers and supervisors, there is a whole team of registered nurses and social workers, a chaplain, an army of volunteers, a dietitian, physical therapist, and so on. Just so many people contribute to the team effort of hospice, and our medical director.
We hear a lot today about advanced directives. Can hospice care be part of an advanced directive?
Of course. In fact, it's kind of a relief to families if families know what their loved ones want. They're faced with an illness that the patient can't make their own wishes known, but that advanced directive is pretty clear. I want this, I want that. I don't want extraordinary measures. I want hospice. Huge part.
As part of the process, and the process of dying is a process from what I've been told,
Right.
Along the way you do provide a level of palliative care, correct? And that could depend on the disease and the person and their tolerance for medication and how uncomfortable they are and how comfortable you're able to make them.
Right. Palliative care, comfort measures are extraordinarily important in hospice. We think that every moment of a person's life is precious, and to that end, we're all about planning. We begin planning for the progression of the illness, what we might see, what we might anticipate, and almost all of our comfort measures are very simple, and anyone can administer them. A wife, a husband, even children can administer to their parents. And they're designed to be used at a moment's notice. They're always there in the home or wherever the patient's living, because comfort's the most important thing.
You know, part of the process of passing is the family involvement and the friends. Do you provide any assistance or help to those folks?
Absolutely. Patients aren't alone. There's a whole group, an entourage, if you will, of people that are important. Might be a neighbor, might be a son or daughter, might be a spouse, might be caregivers that have been with someone for years and years. And hospice does provide as much care for those people, you know, as far as emotional support and so on, as they do the patient. And then, after the patient passes, we have a bereavement program where we look after the bereaved person for 13 months.
Does your program differ if the person's in the hospital, if they're in, say, a nursing home type facility, or if they're in their own home? Does how you handle it differ a little bit?
Well, it depends basically on the intensity of the symptoms, and we have 4 basic levels of hospice care that all hospices provide. If a person is on inpatient level of hospice care, they might be in Saddleback Memorial or another hospital, and that would mean that their symptoms are out of control and can't be managed in any other care setting. As soon as we stabilize the patient and those symptoms are manageable in another setting, we're able to send the patient home or wherever they want to live on routine level of care, which means that we take the team to them. So our nurses and our social workers and our chaplain and our volunteers and our hospice aides will go visit them at home. Then let's say a family becomes exhausted from caring for a patient day and night and they need a break. We can provide 5 days of respite care. We'll actually have the patient admitted to a skilled nursing facility. His same team of hospice care workers will go and look after him there at the facility. And then the patient goes back home after the family's had a little break. And then there's continuous care. If one of our nurses were to go to a home and find that a patient were in pain or nauseated and our normal comfort measures aren't helping, she stays. She stays until she gets the situation under control.
And that might mean administering methods and ways of administering that the family isn't comfortable with or really can't do. Injection, I'm thinking things like injections.
That's right.
Could be part of that.
That's right. We do pain pumps a lot, where we utilize a tiny little needle under your skin and something about the size of a transistor radio. If anyone knows what that is anymore.
Medication
that can be
automatically pumped in, right?
Right. And those measures work really well.
So there's several different levels of care, but I guess the desire for many people is to be in their own home.
That's right.
If possible, and you make that happen if possible.
That's right. And our desire, we hardly ever have people that aren't okay in their own homes. It mainly depends on their support systems, whether there's a caregiver or a family member that's willing and able to provide the physical and emotional and spiritual care that a patient might need at home. We do have hospice nurses available 24/7, I know, because I'm one of them. And it's amazing in the dark of night how frightening and how painful things can seem to be. And so that's what we're there for.
Do you also counsel the family as to what they might expect? Obviously, those of you in the medical field, part of the job, unfortunately, is seeing people pass. For most of us, that may have never happened until us actually watch a person die. Do you deal with the family and some of the concerns they might have? Is this happening? Is this happening? Why is this happening? Is this normal? Is this abnormal? Can you help them through that process?
Oh, we do. And we begin teaching at the moment we admit a person to hospice. And even if someone were walking around and up and doing all the things you and I are doing, certain illnesses have certain patterns of decline, and we begin education right then. You know, if you feel this, then this may happen. We have a lot of written literature that we give families. So sometimes they actually say, she's doing page 10, paragraph 3. You know, they'll call on the phone.
Right.
Or she's doing this, or I just read it, she's doing that.
Right.
And it's all about the planning. It really is.
Well, we think about the family and the caregivers and all. I guess the main focus is on the patient. You had an anecdote in your notes about somebody and their cat.
Oh, we did. We had a big black cat that a patient had been very fond of, and this big cat sat on her tummy for most of the cat's life in her final years. And she had developed a complication of colostomy, and we had a problem because the cat was sitting in the middle of this wound. And it was her desire that she could always have her hand on the cat, always have the cat in her lap. So luckily we were able to incorporate our wound care specialist and use a team of people to deal with that wound. And she had the cat there until the very moment that she died. It was just what she wanted. Wow,
wow. So you try and, again, meet the needs of the patient at all levels, whether it's physically or spiritually or psychologically. You mentioned the spiritual aspect and the chaplains there, as well as other religious folks, to help somebody if that's part of their desire as well.
That's right. And our chaplain is not there to preach or teach. He's there to be a support person, somebody else to talk to. And I have to confess that most of us are women. And so it's nice to talk to another guy sometimes. And he is able to just make people feel comfortable. He just kind of meets them where they are spiritually.
Right. Well, this is a program that certainly is an important one, and obviously the passing of our life is something we all will have to cope with eventually. It sounds like hospice is certainly a way to help people ease through that time, and both the patient and the family can get some great help, it sounds like, through this program.
Oh, I sure hope so. All of us that work in hospice want to be working in hospice. Somehow it's gotten under our skin, and we love what we do. All
right. Obviously, you do an important work, and we thank you for that. We thank you for joining us on the program today. Trudy Jenks, RN, and she's the clinical coordinator for Hospice of Saddleback Valley. That's a department over at the Saddleback Memorial Medical Center. And of course, if you want more information about the hospital, all their programs, how you can be a part of supporting them as well, give them a call at 452-3724. Our program continues right after this.
From day one, it was clear this active retirement community needed a hospital.
And today, Saddleback Memorial, a nonprofit, state-of-the-art medical center, provides excellence in health care for you and for me.